Well, we begin tonight with a family devastated after losing a loved one in a deadly tuberculosis outbreak. Good evening and welcome to 7 Action News at 11. I'm Carolyn Clifford.
And I'm Mike Duffy. Chandra Izinga of Marion, Michigan died just months following an elective back surgery. Doctors discovered the bone graft that was used was contaminated with tuberculosis.
The material came from a now recalled product that was distributed to 7 states. It was implanted in 36 patients, and now the CDC and FDA are investigating after at least 2 confirmed deaths so far.
7 Action News reporter Brett Cast spoke to the woman's family, who is calling for action, and explains why members of Congress are now getting involved.
Chandra was like another mom to me. She was the most selfless, kind, sweet, caring person that you could ever meet.
In a small town like Marion, Michigan, many people know your name. But after years managing a local grocery store, Chandra Izinga was well known in town, revered by many, including her niece, Danae Tassi.
Everybody loved this woman. I don't think you could think of a bad thing to say about her. And she just lived her life so full.
When Chandra had health issues, Danae was one of 3 relatives who donated a kidney. Otherwise healthy at age 57, Chandra had back pain and opted for an elective back surgery, hoping it would help her keep up with her grandkids.
People are going into this thinking they're going to have a better life coming out, and some of them don't get a life at all.
But turns out Chandra was one of 36 patients nationwide to receive a bone repair product from a lot contaminated with tuberculosis bacteria. After more than 2 months of strange symptoms and confusion among doctors, specialists at U of M diagnosed tuberculosis and figured out where it came from.
So what was your reaction, I guess, to learning that it was from the bone graft that was from her back surgery?
I think we were all in a little bit of a disbelief. Like, for one, how can that happen?
Shortly after, the company behind the product, Izeo Biologics, issued a recall, saying samples had tested negative by an independent lab before being sent out. The company, along with the CDC and FDA, are now investigating. Izeo said today in a statement, quote, "We are saddened to learn that a second patient has passed after contracting an MTB infection linked to a single product lot from a viable bone matrix product."
Her death is a real tragedy for everybody.
Congresswoman Debbie Dingell of Dearborn says Chandra's doctor was so concerned about what happened, he contacted her to do something. She discovered the same company had a similar incident just 2 years ago that resulted in at least 8 deaths. She also learned testing for tuberculosis is not required.
This kind of material is not subject to being tested for TB, or if the donor is susceptible to TB. I don't know how that could be or how that could happen.
Dingell sent a letter to the FDA and the CDC with a list of questions. She says at least one other member of Congress is behind her.
Trust me, we will be talking to all of our colleagues and to the executive branch of our government to say, why did this happen again? And how are we going to make sure it never happens again?
Like Dingell, Tassi wants answers, but above all wants change. She hopes that by sharing Chandra's story, it won't be repeated anymore.
It's easy to be angry and you want to blame somebody, but in anything, she wouldn't want all this attention. She would want to make sure this never happens to anybody else.
These procedures all occurred at either hospitals or dentist offices between late February and late June. The CDC is recommending anybody who has received any of these products to begin treatment for tuberculosis, regardless of symptoms. I'm Brett Cast, 7 Action News.
Certainly scary. Thank you so much, Brett. Stay with 7 Action News and WXYZ.com for any new developments on this deadly TB outbreak.